It is April 15th, 2020. My name is Dr. Bobby, and today we'll discuss what it's like working on the front lines of the COVID-19 pandemic. Hello and welcome back. My name is Dr. Bobby. I am a board-certified anesthesiologist and I'm a patient advocate, which means that I'm interested in ensuring that you are armed with the information necessary to make the absolute best decisions regarding your health and otherwise. And on this channel, we are interested in providing content centered around education, motivation, and personal finance in a really easily understood and relatable fashion. So if you find that to be something you're interested in and you find value in our content, please feel free to like, share, and subscribe to the channel. All right, listen, before we get into the content, I think it's important for me to acknowledge the fact that this is my first YouTube video. You have no idea what type of hurdles this has caused in terms of me getting over a lot of things regarding how I come off on camera, how my voice is, all of these sorts of fears that we all have about putting ourselves out there. But with everything that's happening in the media, everything that's going on in society right now, I think it's important for all of us to push past the fear. And I really appreciate you guys for going on this journey with me. In looking around YouTube, I noticed one blaring thing is that there is a lack of the voice of African-American physicians, namely African-American male physicians. And so I think that I have a unique perspective as it relates to how I got here and as it relates to how I can communicate the information that I consider to be valuable to my audience. So I appreciate you guys for being here with me and for going on this journey with me. Now, let's get into the content. All right, so before we talk about what it's actually been like from my perspective to work during this pandemic, I think it's important for us to acknowledge and provide an appropriate definition for what exactly it means to be a frontline healthcare worker. A frontline healthcare worker is essentially any person who works in healthcare who has the potential risk of becoming infected by a patient. This is not a term that is just for physicians, and I want to make that extremely clear because many people are at risk of getting infected with this virus who work in healthcare that are not doctors. But for the purposes of this video, we will talk about things from my perspective as an anesthesiologist. And speaking about what it is like to actually work during the COVID pandemic, I think it's important to separate the emotional aspect of what it's like to work during this pandemic from the economic impact and also from the occupational impact as it relates to what anesthesiologists do. So I'll spend the first few minutes talking about, the emotional impact of this. And as many of you could imagine, this has been an extremely stressful time for a lot of reasons for everyone. This is not just a stressful experience for anesthesiologists. It is one for all folks who work in healthcare, but specifically for us, we are unique in that we have a very high exposure rate to this virus because of what it is that we do. Because we work in the patient's airway, because we are constantly bombarded with potential viral particles from symptomatic and asymptomatic patients, there is a large amount of fear of contracting this virus from an occupational standpoint. And so there have been a lot of policies put into place to help to decrease the risk that anesthesiologists would become infected with the virus. Mainly, we are very concerned about using personal protective equipment. That is what PPE stands for. And personal protective equipment is of extreme importance in our specialty because it provides a shield for us to be protected. And these are inclusive of what you all have been hearing about in terms of the N95 masks, which are used as respirators to create a barrier between our breathing in particles when we intubate patients. That means placing a breathing tube. When we extubate patients or when we come into contact with patients who we know are positive for the virus. So this also includes face shields, gowns, etc. So there is a lot of information and a lot of resources that have been developed in our hospitals to help to protect us. But that doesn't take away the fear that a lot of professionals, specifically anesthesiologists, feel in this regard. Obviously, we have an obligation to patients, but we also have an obligation to our own families. So there's a huge amount of fear, and with that fear comes stress. The other part of the fear that a lot of anesthesiologists feel during this time has to do with the fear of the unknown. There is changing information every day as we all watch the news. There is different policies coming out at the hospital literally every day. When you check your email, when I check my email, I literally get at least 50 emails from hospital administrators and from my colleagues on new recommendations as it relates to both treatment and to personal protective equipment and to things that are related to the way in which we have to practice now during this pandemic. So the fear of the unknown and the fear in terms of just the lack of control are things that have really changed the way in which we practice. Most anesthesiologists are used to compartmentalizing their fear because we work in a specialty that is high stakes. We have to be able to think clearly and act quickly in very emergent and urgent situations. So typically we're able to compartmentalize these things, but because of the news and because of how this entire pandemic has affected everyone in a 360-degree fashion, it's really hard to be able to compartmentalize it. So there is a large amount of fear, and most of that fear comes from getting sick, exposing your family, and also from the fear of the unknown. So regarding the economic impact that COVID-19 has had on anesthesiologists, obviously this economic impact that this pandemic has had on everyone has been tremendous, but more specifically related to healthcare, if you could imagine, most anesthesiologists and surgeons make the revenue for ourselves and our livelihoods based on the amount of elective operations that happen in the operating room. And by elective operations, these are operations that otherwise normal folks come in from the outside, they have their operation, they recover, and they go home. Unfortunately, because of the way in which COVID-19 is spreading, and to better protect patients who are in the hospital and to protect and decrease the amount of spread amongst hospital workers, the overall consensus for most hospitals in the United States has been to stop all elective operations, which, if you could imagine, has decreased hospital revenue and unfortunately has had economic impact on many anesthesiologists that I know, many of which have been furloughed or their responsibilities at work have been changed, or some of them have even had tremendous cuts to their salary or otherwise not working right now. So if you could imagine, that is extremely stressful and also adds to the fear that a lot of anesthesiologists feel at this time. Now, in terms of the occupational changes that have happened as a result of what we do, there have been many changes in terms of the way that we've had to learn how to work, and the way in which our workflows have changed, and the way in which we've had to operate at the highest level of our training. Many people understand anesthesiologists as fairly simple folks who provide anesthesia for operations and work primarily in operating rooms, but we have a lot of training that can allow for us to flourish outside of the operating room as well. Namely, we receive a lot of training in critical care medicine. So when you go to the ICU, it's possible for the ICU physician who's taking care of you to be an anesthesiologist. Also, a lot of anesthesiologists work in pain medicine and also in other areas of the hospital. So because of the onslaught of the critically ill patient, we are now taking on more responsibilities outside of the operating room, which for the most part are actually probably really good and certainly useful to our patient populations. So currently where I work, we're spending a lot more time in the ICU providing our skills to the intensive care physicians who work in the ICU, helping patients there, intubating patients there. We're leading code teams throughout the hospital, meaning that if a person goes into cardiac arrest or has some sort of an abnormal heart rhythm that is not compatible with sustaining life, we are running these codes for the hospital. We are participating in committees to create protocols. Essentially what we're doing is we are functioning in ways that make us way more valuable to our hospitals than just folks who are providing anesthesia services in an operating room. We are intubating all patients in the hospital. Because we are the sort of airway experts, we are designated as the folks who have to take on the supreme risk of intubating patients who have COVID-19 and otherwise taking on the risk of also being exposed in the act of intubating these patients. So with that being said, we've had to operate at a much broader capacity in our training and not just in the operating room. So I'm sure that many of you are probably thinking, my God, that got to be super stressful. How are you holding up? How is everyone holding up in terms of those who are working on the front lines? In terms of my colleagues and myself, as I speak for myself, I think that I'm holding up pretty well. I think that it's important for us to be able to compartmentalize the emotions of fear so that we can act in logic and we can still be effective for the patients who require our services. I think it's important for us to have good sense practices in terms of protecting ourselves and protecting our families, and obviously doing everything we need to do to decrease the spread of this virus. But I think that overarching, it's important for us to compartmentalize those things so that we can think clearly and act quickly. I think it's important for all of us, including my colleagues and all folks who are in healthcare, to self-care. You have to take care of yourself. You have to do things that are going to allow for your mental health to be sustained during this time of stress, whether that be exercise, whether that be meditation, whether that be means of spending time with your family or prayer. These are very, very important coping mechanisms for the stress that we are being inundated with. This amount of death and this amount of things that we are experiencing are not normal, and it is okay to be overwhelmed. But we will get through this. It just takes diligence and determination and the ability to work together. So with that being said, I'd like to thank all of you for going on this ride with me during my first YouTube video. This has been a huge learning experience, and I'm sure that throughout making more videos, I'll become more engaging and I'll be better in front of the camera. And I just want to thank you guys for just being patient with me. Listen, if you like this video, if you found value in this information, please feel free to like, share, and subscribe. Please check back to my channel. I'm going to try to make sure that I upload a video at least once a week. And, until next time, listen, I'd like to take a moment just to thank all the folks who are on the front lines, who are working to ensure that we beat this virus. I'd like to thank all the folks who are working out at the grocery store and all of you guys at home who are doing your social distancing and working to beat this thing. We're in it together. Peace.